Good afternoon, everyone. I am Carl Jason B. Shera, tasked to report as part of the Topic 2 Ethical Issues in Counseling Practices, specifically the right of informed consent and dimensions of confidentiality. So here's the topic outline of this report. First, on the part of the right of informed consent, I will first define what is an informed consent in counseling, its benefits, the process of informed consent. Um, uh, I will also discuss about the difference of the written and oral informed consent, the exceptions to informed consent and counseling, and of course, the validity of informed consent and counseling. While on the part of the dimensions of confidentiality, first I will define what is confidentiality, the purpose of it, when to break confidentiality in counseling, and lastly is the client rights and contracting is key, or the summary of the dimensions of confidentiality. So first is the rights of informed consent. So what is informed consent in counseling? Informed consent in counseling is the process of sharing information with a client for them to be able to make informed decisions with regards to his or her participation in the proposed treatment. And also informed consent should be given willingly by the client based on being adequately informed on the treatment or therapy they are about to participate in. So, in other words, informed consent, what an informed consent is to inform the client of his or her participation, and it should be it is I highlighted that the client is um, willingly give his or her consent to participate in the proposed treatment or therapy. Next is the benefits of informed consent in counseling. So first, informed consent provide clients with needed information, reduces their dependence on the therapist and empowers them to function autonomously. Also, informed consent promotes collaboration between client and therapist, and it helps to foster a positive working relationship in which trust and openness is encouraged. So, diba, as we all know in this field that building trust and openness really is highly encouraged, and informed consent is one to uh, reinforce the trust and openness we build for clients. As informed consent also sets reasonable rule, exceptions, and responsibilities. It helps to reduce the risk of exploitation of clients. Also, the informed consent gives the increased understanding of proposed treatment by clients and reduces anxiety and apprehension. This also facilitates an informed decision by the client. So, informed consent does not only reduce the chance of exploitation for clients, but also reduces clients' anxiety and apprehension. Informed consent works to promote ethical practices by ensuring that the client has the right to dignity, justice, and a sense of autonomy. And informed consent also gives a strong therapeutic relationship, and it offers the therapist a chance to prevent ethical violations and or legal liability that may occur during the course of treatment. So informed consent does not only promote ethical practices, but it also gives a therapist or the counselor a chance to prevent ethical violations and or legal liability. So next is the process of informed consent in counseling. So there are three steps in this process. First is providing information for the client. Here, the counselor must communicate the nature, benefits, and limitations of the treatment or procedures, as well as any other eventuality that the client is agreeing to. Also, here, the counselor or therapist should provide alternatives to recommended treatment if there are any, and ensure that the client is aware of all the options. When you say all the options, it includes information about likely outcomes of the treatment, the release of information, recording of the session, and should also be presented. This also should be presented in the client clearly. The client should be given an opportunity to ask questions and engage in discussion with the counselor if he or she wants to. The number two step is to evaluate the evaluation of client's capacity to understand information. So dito naman, once the information has been provided, the counselor will have to evaluate whether the client is able to understand the information, and if he or she is competent to make an informed decision with regards to the treatment. It is essential for the counselor to ensure that the client is able to comprehend both the risk and benefits of the treatment or procedure. And the last step here is obtaining consent from the client. In this step, the client will need to acknowledge that he or she has been properly informed and express their consent. A consent form signed by the client is the most common way to document that information has been received, read, and understood. Informed consent should always be obtained before treatment begins. And for situations in which a patient or client is not able to make independent decisions on their own but does not have a designated decision maker, the court may have to appoint a legal guardian to make the decision. Next is the difference between a written and an oral informed consent. So, informed consent can be obtained through writing or orally. First, a written document or a written informed consent provides clients with the chance to go through the information at their own pace. It also allows the counselor to keep a hard copy of the signed form as proof of consent. While on the other hand, an oral informed consent or this oral Oh yeah, an oral informed consent is more flexible and allows the counselor or therapist to customize information for their clients. Also, it helps to facilitate discussion on the treatment. But in reality, a combination of both written and oral consent is the most ideal way. So, written and oral informed consent, should I say, should work or should be used hand on hand. Um, Consent forms should not stand alone, and clients should have the opportunity to ask questions or discuss options during the process. So, both the written and oral methods should adhere to the applicable laws and professional ethic codes. So, in giving informed consent, we should not only give it as a written form or as a printed form that the clients will read on their own without even giving them the chance to discuss or to ask questions. Rather, we should use both written and oral informed consent to facilitate a more holistic informed consent. Exceptions to informed consent in counseling. So there are times when exceptions to obtaining informed consent can or should be made. So we say, for example, that it is permitted in many countries and professional codes of ethics to provide treatment and or assessment during life-threatening emergencies. So this include situations where the client is a danger to self or others, as well as when there are serious cases of abuse or neglect. Exceptions also can be made when the patient is incapacitated or when he or she voluntarily waives consent. By the way, when you say incapacitated, the client is not able to be legally, cognitively, and emotionally competent to give consent. Next is the validity of informed consent in counseling. So, for informed consent to be valid, certain standards have to be met. Number one, consent from clients must be given voluntarily. The client must be, like what I've said earlier, legally, cognitively, and emotionally competent to give the consent. The counselor or therapist needs to ensure that the client understands what he or she is consenting to, and information shared, agreements, and or consent given need to be documented. Next is the validity of informed consent in counseling. Here, this is an example of an invalid informed consent in counseling. So a client may verbally agree to something out of social pressure or fear, or the client may have difficulty in expressing their true feelings while the person performing the assessment or treatment is honestly unaware of this. So this is an invalid informed consent. Why? Because there is no signed document, a written informed consent that the client will sign that approve that he or she give her or his decision to be to or to participate in the therapy or or in the therapy or in the treatment. And of course, there is no chance also for the client to ask questions regarding to the therapy or to the treatment, but just verbally agree because of social pressure or fear. while this one is an example of valid informed consent in counseling. So, an individual struggling with depression might want to start counseling sessions in place of taking selective serotonin reuptake inhibitors. The therapist would be required to inform the potential client of the risk as well as possible benefits of this decision. This would include informing the client of the potential relapse when stopping the medication. And additionally, the therapist should also provide information on alternative treatments that are available, such as group therapy, and the client should also be given a chance to ask questions and discuss their treatment. So, this is a good example of a valid informed consent. Next, we'll move on to the dimensions of confidentiality. So, confidentiality in counseling creates a space where the client can explore sensitive subjects in the knowledge that the counselor will not repeat or misuse the information discussed outside of the counseling room. For the counselor, maintaining confidentiality within certain limitations is an ethical responsibility, and it is part of what makes counseling different from other relationships. And the purpose of confidentiality in counseling is that when a client seeks consultation with a therapist, it is important that they feel able to trust their counselor so they can speak freely and openly about what is troubling them. And through confidentiality, it gives assurance that their feelings, thoughts, and stories can be entrusted to the counselor and may allow for deeper exploration of areas of experiencing which feel particularly difficult or shameful. This also gives safety, or this safety helps to build relational depth and facilitates the work of therapy. Next is when to break confidentiality in counseling. So here is an outline of some of the main limitations of confidentiality in counseling. So first are the legal limitations. Number one, if a client discloses involvement in or information about acts of terrorism, the therapist is legally obliged to inform the authorities and cannot inform the client of their intention to do so. Number two, if a client gives the therapist information regarding money laundering or drug trafficking offenses, the therapist is obliged to pass this information to the police. And number three, a judge or a coroner can legally order the release of the client's notes. Um, and this one naman is the other common limitations in breaking confidentiality in counseling. So first is supervision. So most professional bodies require the counselors undertake regular, ongoing supervision of their client work, and this is anonymized. And the focus of supervision is on the therapist's work rather than the client's material. But nevertheless, this is a limitation of confidentiality which the client needs to be made aware of. Number two is risk. eh, Uh, um, the break of confidentiality should or a counselor or therapist should break confidentiality when there is a risk of harm to self. So if a client is expressing suicidal thoughts or at least an intent, the counselor will have policies to follow regarding when on and how confidentiality will be broken. It is important to be aware of policies within any organizations that the counselor are working in and act in accordance with them. And number three, if there is a risk of harm to others. So most organizations and therapists in private practice have policies in place designed to protect children and vulnerable people. And although there is no legal obligation to report abuse, safeguarding is an ethical responsibility. And in some cases, confidentiality will have to be broken. In circumstances where there may be an increased risk to a child or vulnerable person, clients are unlikely to be informed that the therapist intends to break confidentiality. And lastly is the client rights. So, uh, so that a client is able to make informed decisions about what they wish to disclose, it is important that they fully understand and agrees to all of the applicable limitations of confidentiality from the outset of their therapy. And this is where contracting is paramount. A contract should outline all the limits of confidentiality in counseling and additionally should provide clarity about the way client notes are produced and stored, including the length of time they will be kept and any circumstances in which they would be disclosed. The client also needs to have a clear understanding of how their personal information is stored and used. The contract should ideally be written, signed by both parties, the counselor and the client, and discussed carefully to ensure the client fully understands and agrees with the terms. And unless there are legal or defensible reasons for withholding the informations, such as what I mentioned earlier, like the risk to national security or the risk to a child or vulnerable person, clients usually have the right to be informed when confidentiality is going to be broken. And organizations may have specific policies and procedures on the requirements to break confidentiality, and it is important to counselors to familiarize with the organizational policies as well as the ethical framework for the counselor's professional body. So here's the reference for this report. Thank you so much for